Hello and welcome. This is Dr. Jerry Cuomo in Boca Raton, Florida. I'm here with Vicky's case, which is a porcelain laminate to veneer case. Vicky presented with very crooked, stained, and malaligned teeth, and she was also concerned about her bite. So as you can see from the photograph, we're dealing with not only crooked, stained, and discolorations, but also there's a slight black triangle right in the midline. Her midline is a little off, but not off terribly where we have to be very concerned with that. She does have very nice lip support, and it looks like her back teeth are covering the corners of her smile. So we're going to walk you through this case and cover everything from temporary removal, of which she had to wear for 2 months. So these are individual temporaries that she'll be wearing, and also the cleanup and the trying in of the case, and then ultimately the treatment of each of the laminate veneers. Now this veneer system is called Dentist-Porcelain, and it was brought out, I want to believe, in the early 2000s, but it's one of the nicer feldspathic porcelains that we're going to use. So this is Vicky's case, and we'll be covering her with the next several videos. And so right now we're looking at the post-op of Vicky's case, and you can see how we did cover the asymmetry that she had in the size of the teeth. We made the two front teeth very much dominant, and followed her lower lip line, although she is smiling kind of crooked right now, but when she normally has her smile, those teeth line up perfectly with the lower lip. And each of the teeth, there's 6 teeth involved, are covered nicely. Incidentally, if you want information about bonded porcelain restorations, there's a great book out by Pascal Mangi and Urs Belzer. It's called The Bonded Porcelain Restorations in the Anterior Dentition, a Biometric Approach. So I highly recommend that book. So here we go. These are her 6 individual temporaries. I'm going to show you how we take off just one. We'll take off number 8. We'll try to do that by just lifting with an instrument, and obviously they're very retentive. She went away for a short vacation, plus she couldn't be in the chair for about 8 weeks, so they're on pretty solid. So what we have to do is we have to separate the composite, which is triad material, from Dentsply. And we're going to do that with a fine diamond burr, and just go in and actually make a simple separation in the front of the temporary. So for the viewers out there, this is done with anesthetic, although we're not touching any part of her tooth. We're just going to make a slight separation in the labial contour. We're going to just do one and try one veneer in, only because if the color doesn't match, we're stuck just remaking the one temporary and not remaking them all. So we're going to show Vicky what that veneer looks like. Again, these temporaries are on with a just spot adhesion in the middle of the tooth, and then we cleaned up the excess temporary cement. It is a little closer shot here, shows you how we're doing this with higher magnification because we do not want to nick her teeth. Now this is the tooth preparation, which is a very rounded preparation. She did need some incisal length, or the length of the tooth added, so it looks short right now, but it really is just a little bit of reduction incisally. Now we're going to go right to packing the cord and retracting the tissue, and this is Siltrex number 7. Why do we do this? Well, we want to make sure that that tissue stays very comfortable and doesn't bleed while we're trying in the case. So again, with the high-powered microscope, we're able to accomplish this And again, that is her tooth getting ready for bonding, and we'll zoom in on especially around the margin to make sure that there isn't any debris or any residual temporary cement left there. For you dentists that are viewing this, feel free to contact me at my email address. Also patients, if you prefer to talk about the case a little bit further, feel free to contact me at my office. Again, here it is blown up and moving from one magnification to the next. Our office number is 561-391-6290, and our website is www.gcuomo, that's GCUOMO .com. These are the laminate veneers. Now I'm just showing you each one of these that are going to be placed and tried in individually. There's number 8 and the two smaller teeth next to it, and then of course the eye teeth. So that's where we are now. We'll go ahead and try them in. And this is the first one, number 8, right central. And we'll show the patient the color, so you want to make sure that when you do try them in, you try them in with water. And here they are, multiple units now being tried in. Number 8, and the tooth next to it, number 7, and then on the other side, on the left side, be number 9. So there they are, 3 of the 6 veneers tried in. You notice the incisal edge is longer than what Vic had. And right now she's also viewing these veneers and has already accepted the color to the color match. Also reviewing now, we're going to go ahead and etch each one of these. This is a special hydrofluoric acid that will go on the veneer side only, on the inside. Our laboratory, when they make each individual veneer, it's made in such a way, it's on something called feldspathic stone, because these veneers are made with a layering technique, so that particular type of stone is a divestment material that will go in the oven and then fire each one of these individually. So now we're preparing the bonded surface of the veneer, being very careful with the microscope not to place any of this on the outside, because we don't want any of the mastics or adhesives to adhere to the outside. It makes cleanup very difficult. So you've got to have a microscope when you're doing this, and you've got to have that little line. If you notice, there's a tiny little line that's placed by the laboratory technician and allows us to follow exactly where to etch. Now this acid etch will be rinsed off, and then a silinator or silination procedure will be the next step. And silinating the surface, only that surface that's etched, will allow us to bond them in on a permanent basis and make them very strong in the bonding. So this video is just going to cover to this portion. We're going to show you the actual techniques of bonding in each one of these veneers in the next 2 to 3 videos. So stay tuned. Again, Dr. Jerry Cuomo here, and working in the private office on a veneer case. Again, you can reach us at 561-391-6290.